Almost 30 million Americans will suffer from an eating disorder at some point in their lifetime. That's according to an organization that's aimed at fighting eating disorders. Joining me now is Francesca Johnson. She's on the Eating Disorder Coalition of Iowa board that is developing a text application meant to connect Iowans with resources to improve awareness and prevention of eating disorders. So Francesca, thank you so much for being with us today.
Yes, thank you so much for having me.
Yeah, so I know quite a bit about your organization because I've been involved off and on over the years as someone who suffered from an eating disorder in college and for several years beyond. So this is a really big deal. Explain to people how this text-based application would work.
Yeah, so I actually struggled with an eating disorder myself for many years, and I know that it's very hard to find resources and other things to stay anonymous and not have just a lot of information coming at you that you don't really want. So this text-based application is going to be a way that you can text a number and you can be a provider, a caregiver, or someone in recovery, and you'll get back information based on keywords that you text actually.
Okay, so tell me a little bit about that. Like what kinds of keywords would sort of be pinged in this, I guess?
Yeah, so we're going to have three different categories. Like I said, the provider, the caregiver, and the people in recovery. And so the provider maybe will do do's and don'ts when you're working with eating disorder patients, or caregivers, we have certain like meal support or things like that that they can do for people with eating disorders that won't trigger them and will also help them get to that place of recovery.
Wonderful. So I feel like a lot of people still don't understand that eating disorders are mental health disorders. And, you know, mental health is something that we've really been talking a lot the past few years, particularly during the pandemic. What has EDCI seen in terms of eating disorders through the pandemic? Is this an issue that's gotten worse for people?
I think it's a lot easier to hide during the pandemic, and something I've learned about eating disorders just through my experience and through being with others that have suffered is that you want to hide, right? You don't want the stigma of mental health. You don't want people looking at you and watching you eat or not eat. And so I think it probably has increased, and it's actually one of the leading causes of death among mental health patients. And so during the pandemic, I could only see it going up. I'm not positive myself, but that would be my thought process.
Yeah, that makes sense to me as well. So talk a little bit about fundraising for this because, you know,
Yeah.
unfortunately, money makes the world go round. We got to pay for this.
Yeah, so we're doing a Thrivent campaign, and if you don't know what Thrivent is, they're gonna, it's a financial organization that's going to match our donations up to $10,000 to help fund this application and get it out to all of the residents of Iowa that could use it. And so if you go to edciowa.com, so edciowa.com, you can find it on the Text Ed Resources tab, and you can actually donate to our Thrivent campaign so that we can help because we'll have to pay for text messages and hosting this service and application just fees and things that go along with it. So anything that you can do to support it monetarily, or if you want to reach out and help volunteer, that's great too.
Absolutely. We'll make sure we get that information up on our website. So tell us a little bit about coordinating with local organizations and even government with this.
Yeah, so basically we're going to start with this, like going to different hospitals, local into Iowa, and try to get this number into the provider's hands so that they have a lot of information that they can text and receive it quickly in case they're dealing with eating disorder patients, as well as caregiver like long-term facilities that use this type of information. So I think that's probably where we'll start, kind of like ground roots with EDCI. And then we'll hopefully get it in the hands of like therapeutic groups around the state that can give it out to people in recovery that can then text and get resources to better their recovery process.
Absolutely. And then people literally have a recovery tool in the palm of their hand.
Yeah, if you have a phone, you'll have it. And it's just a text message.
All right, Francesca, thank you so much for being with us today. This is literally life-saving information. We'll make sure to push it out on our website and on social media to help you raise the money that you need to make it happen.
Thank you so much. I really appreciate it.
All
Thank
right.
you a lot.
Thank you.